Here are the 3 most difficult symptoms I have seen when dealing with someone with dementia. Dementia can be a very difficult disease for the person with dementia and the person caring for the person with dementia. The 3 main symptoms I see before they're on hospice and while they're on hospice are 1, terminal agitation, 2 is aspiration pneumonia, and 3 is their overall functional decline, leaving them max assist for all ADLs, meaning you have to change them, feed them, turn them, dress them, everything. It can be very difficult. So here's how we manage it. So agitation in general is very common with all dementia patients, no matter what stage they're in. They will have moments of confusion, agitation, combativeness sometimes, and they will be unwilling to work with their loved one to try to help them calm down. I talk about terminal agitation, which presents itself the same as any other agitation. It just happens when someone is closer to death. So how do we treat this agitation in general? So 1, we try to be less aggressive at first. Can we just darken the room, decrease the stimuli, distract them, have them watch TV, something to kind of calm them down? If that works, great. And some days it will work and some days it won't work. And when it doesn't work, that's when we have to move into medication. Sometimes it's an easy fix. 1 pill of something will help them not be as agitated. That will work for a while, and then suddenly it'll stop working. So we have to either try something else or increase the dose. It all depends on the person. If you are living with someone with dementia, you know they have good and bad days. Sometimes the medication works, sometimes it doesn't. That is why hospice is here, to try to help with that. Once the disease of dementia has advanced more and the person is having difficulty swallowing pills or maybe even refusing to swallow pills, we will have to look for other routes to give the medication, which we can do on hospice. We can give it sublingually, transdermally with patches, and even medication through the rectum, which I know sounds awful and people always don't want to go there, but from my experience, it's one of the best and most effective ways to give medicine. And before we go into the other 2 symptoms, I want to talk to you today about the sponsor of this video. So this is my first time doing this, and I'm really excited to announce that I'm being sponsored by the Macy Catheter. So this is not just a random product. This is something I truly believe in. You guys hear me talk about giving medications rectally all the time. I think it's super effective, and this is a new and improved way for it to be happening. So what is the Macy Catheter? The Macy Catheter is a small flexible tube with a little balloon at the end that holds it right in place in the rectum to deliver medication. And the best part about this is that it was developed by a fellow hospice nurse. The Macy Catheter is an effective way to give medication without using needles, without forcing medications or trying to get someone to swallow medications. Sometimes people need too much sublingual medication, so it just sits in their mouth, not being absorbed. This is a perfect way to solve those problems. It's painless and it's super effective. Now, before you say no, I have seen this thing work miracles, and hence why I have joined forces with them to get the word out about the Macy Catheter. 1, it either controls their agitation, it helps them relax, and 2, I've seen it manage pain so well the person is able to get up, move around, administer their own medication, and live their life again. If you want to learn more about the Macy Catheter, talk to your hospice provider or click the link in my description. Now let's get back to the video. So, aspiration pneumonia is the 2nd most common thing I see with people who have dementia. Why does this happen? This happens because they start losing their ability to effectively swallow. So they can start aspirating or choking on the food that's given to them. Sometimes you can tell because they'll start coughing, and sometimes they do what we call silently aspirate, and you can't tell that they're doing it. You usually just find out they have because they start getting pneumonia. So what do we do in this circumstance? 1, we have to put the patient on aspiration precautions, which means anytime you're feeding them, they should be head of bed up almost to 90 degrees. So almost straight up when feeding them. You may want to puree all of their food, and they may be needing to get fed themselves. Never force any food. That's the #1 way you can cause aspiration pneumonia, by trying to force someone to eat. So you let them be the guide. If they're willingly taking the food and easily swallowing it, we're good. If they are shutting their mouth or holding their teeth clenched, let it be. Don't try to force the food. Now you can always come back a couple hours later and try again. Maybe they'll want it then, but always let them be your guide. And if when in doubt, always ask your hospice company, what do you think? Should they be on aspiration precautions? Are they swallowing okay? And let them see and tell you what you should do next. So the last thing I see with almost all dementia patients is full functional decline, which means they are fully bedbound, they can't turn themselves, they can't talk, they can't walk, and their loved ones or their paid caregiver, whoever is there, is the one who has to fully take care of them. Now, because of this can cause skin breakdown. And you can care for someone the best you possibly can, and they can still get skin breakdown when they have dementia. 1, because of the functional decline, and 2, because of the nutritional decline, which is no one's fault, right? So the best thing you can do for them is keep them clean, keep them safe, and keep them comfortable. I would check them frequently to see if they have wet briefs, because that's one thing that can help with this, that can cause skin breakdown, sitting in a wet brief. And I would also frequently turn them, even if it's just a little bit, turning them off their bony backside or any kind of bony prominence on their back or shoulder blades, keeping them turned at an angle for a couple hours, and then turn them again on the other side for a couple hours, having them lay flat for a couple hours. Now in the hospital, there is usually a rule of someone has to be turned every 2 hours. If you're home on hospice, I wouldn't personally do that. I would say every few hours is okay, or every 2 hours during waking hours, and then let them sleep at night just so they can get a full night's sleep and you can get a full night's sleep. But in general, keeping them clean, dry, safe, and then trying to turn them every couple hours will help with that skin breakdown. Thank you so much for watching. Let me know if you have any questions about dementia or anything you want me to follow up on. And don't forget to like and subscribe for more death and dying information.